Thank you for listening to my presentation, which has recently published in Obesity Surgery Journal. The title is Acute Change of Non-Esterified Fatty Acid and the Remission of Type 2 Diabetes. This research has already started since 2015, in March 2015, and is recently finished. The prevalence of diabetes is increasing sharply, and New Zealand is not an exception. Today's research are mostly focused to find out the novel biomarker, and free fatty acid is one of them. It has been shown that people who are obese have more free fatty acid, and more free fatty acid causes the higher risk of insulin resistance. And insulin resistance, as you know, is one of the most important risk factors of type 2 diabetes. It has shown that free fatty acid has a property to suppress insulin secretion, and through this it may be cause of the insulin resistance and directly type 2 diabetes. We have several kinds of diabetes management, including pharmacotherapy, bariatric surgery, and very low calorie diet. In this study, because pharmacotherapy is not the most effective method for the remission of type 2 diabetes, so in this study we try to work on bariatric surgery and very low calorie diet. Very low calorie diet, first let me introduce you very low calorie diet in this study. Very low calorie diet is a kind of supplementary food which has 400 kilojoule energy per day, and so this kind of management has already shown to have a important effective impact on the remission of type 2 diabetes. It has already documented in human and animal studies. And we have another kind of diabetes management which is called bariatric surgery. We have several kinds of bariatric surgery, but out of them, sleeve gastrectomy and gastric bypass are one of the most effective treatment for type 2 diabetes. How can I go to this? So before that, let me introduce you these two kinds of the surgery. This is the stomach just before the surgery. You can see that the intact stomach is there. But this is gastric bypass. This is the most effective method for the treatment of type 2 diabetes. So for this surgery, first surgeon makes 5 to 6 incisions on the abdomen wall, and then stomach is divided to two parts, a small pouch which is 15 to 30 milliliter volume, and the remaining of the stomach. Then alimentary Y-shaped tube, as you can see, this is like Y-shaped tube, is inserted from the duodenum to duodenum. So any consumed food consumed in the body is directly passed through from the alimentary shape, from the stomach to the colon, and so very small portion of food will be digested. This is the kind of malabsorption surgery. Another kind of surgery which is pretty new compared with the gastric bypass is a sleeve gastrectomy. As you can see in this surgery, 80% of the stomach is removed from the body, and only then using the surgical stapler, two sides of the stomach attached to each other, so you can see the banana shape here. Basically, this kind of the surgery, because of its property, fundus, which is in the 80% of the stomach, is removed from the body. Fundus is the place where incretin hormone are released and produced. So they remove from the body, and very big change of the hormonal change can be seen after this kind of the surgery. So we do know that after a year or long-term surgery and very low calorie diet, we have a good remission of type 2 diabetes. But the aim of this study was to find out whether in a short term, like 3 days or acute phase of using very low calorie diet and gastric bypass, is there any significant change of free fatty acid in 3 days? So the aim of this study is to compare acute effect of bariatric surgery and very low calorie diet on beta cell function in obese with type 2 diabetes. For this study, first of all, based on the inclusion and exclusion criteria, The surgeon selected randomly this patient, 11 patients for gastric bypass, 13 subjects for very low calorie diet, and 14 subjects for a sleeve gastrectomy. Some of the important inclusion and exclusion criteria included like type 2 diabetes with the recent onset, like 5 years, less than 5 years, and exclusion criteria such as no gestational diabetes, no cardiovascular diseases, and off medicine for 72 hours before this intervention. So just before before starting the intervention, oral glucose tolerance test was performed in all the patients, and 3 days after that. After separating plasma from the whole blood, non-esterified fatty acid or free fatty acid was measured by liquid chromatography mass spectrometry. Incretin hormone, in this study we only measure C-peptide, glucagon-like peptide or GLP-1, and gastric inhibitory polypeptide is performed by ELISA, and biochemical analysis such as lipid profiles and glucose and insulin was done by autoanalyzer. For a statistical analysis, we did pair-T test in this study and Pearson correlation. Also, we utilized MATLAB to calculate HOMA indices such as total insulin secretion and homeostatic model assessment of glucose for insulin resistance, and other indices using the MATLAB and mathematic calculation. So the result of this study, before going to the result, this study is done only in 3 days. So we compare all the results just in 3 days. So all the results are independent of any significant losing weight. You can see that the BMI in all interventions are the same. So they didn't change significantly. So any change can be any change which can be happen is just independent of losing weight. We found that insulin significantly decreased only in diet, which may show that the superior effect of very low calorie diet on the remission of type 2 diabetes in a short term compared with bariatric surgeries, which is maybe in the long term is better than very low calorie diet. As you know, we can't get the very low calorie diet for a long time. We can prescribe it just for 2 weeks, 3 weeks, not for 2 months or 3 months, because it's not easy to ask patient to eat for 2 months, 3 months, very low calorie diet. And we also, interestingly, we found that palmitic acid is significantly decreased in all kind of the intervention. So even in very low calorie diet, gastric bypass, and sleeve gastrectomy. An area under the curve is only significantly increased after both kind of surgery, namely gastric bypass and sleeve gastrectomy, which may show that the effect of anatomical change in the body. So you can see that there is no significant change, although the GLP-1 is increased after very low calorie, but not very significantly. So it may show that the most impact of anatomical change in the body for the remission of type 2 diabetes. And we also found that unsaturated to saturated ratio of the free fatty acids significantly increased in all intervention. The good things about this study, this is the first time we present the unsaturated to saturated ratio, which can be, it is not easy to say that this palmitic acid and unsaturated to saturated ratio can be considered as a biomarker for type 2 diabetes remission, but we need to have more large sample size, and we need to do in the different population, but it can be considered as a pilot study for further analysis and further research. So we conclude that palmitic acid significantly reduced after all kind of the intervention. And also we found that there is an association between several kind of free fatty acid with indices of glucose homeostasis and glucose function. And also we found that insulin resistant and beta cell function associated with non-esterified fatty acids. This is the references, and I would like to thank you, my supervisor, Professor Jun Lu, and Dr. Rinky Murphy from University of Auckland, and Professor Lindsay Plank, my co-supervisor, and all participants in this study. Thank you.
Thank you, Reza, for your presentation. So now we are open for any questions from Reza.
Hi. Excellent presentation, Reza.
Thank you.
Just one quick question. You said if BMI was constant and the insulin levels were changing, they were getting up or down in your study. I just wanted to know, is diabetes not related to weight, I mean obesity of the person?
Yes, of course. The diabetes, there is a direct association between diabetes and obesity. Most obese people have diabetes, or people who are diabetic have obesity at the same time. But the thing, this study is just done in 3 days. So this is not for a long. Maybe if we wait for 2 months, 3 months, maybe we can see the change of the weight, because we have very low calorie diet and we have gastric bypass or sleeve gastrectomy. But it is just in 3 days. So you can't expect that you can see the change of weight just in 3 days. So yeah, but we see that insulin has been changed, so it may be because of the superior effect of very low calorie diet after this kind of intervention.
Thank you.
So what's the advantage of having this short time comparison between before surgery and after surgery?
All the research was done in a long-term study. We don't know exactly in the short term, is there any change after kind of the intervention, because in the long term, of course, we can see the change. But in the short term, we have several acute changes in our body. So, but most of the research done in 1 year or 6 months or 1 year after the intervention, and some of them will be get back to the previous stage. So we want to see that the acute change of free fatty acid just few days, just few hours after the intervention. So the advantage of this study is to compare that very short study, very short comparison with the long term, because we do know about the long term study, but we don't know exactly how much change is happening after 3 days.
Can I ask a question about the implication of this bypass, if you want to think about, because you brought a big issue about diabetes and obesity that we are facing a lot in New Zealand. So do you suggest that this bypass can be an effective treatment, or based on your findings on the increase of saturated fat and monounsaturated fat, do you think it can be effective?
To be honest, no, it is not the effective one. Bariatric, especially gastric bypass. We have a kind of surgery which is called biliopancreatic diversion with duodenal switch. That kind of the surgery has already shown in a 15 years study has a good impact and effective impact on diabetes remission. But most of patients who have diabetes and they did the gastric bypass, after 4 or 5 years, again, they have to use the medicine. But it is not like for 100% of the patient. This effect of this study has a remission of diabetes in 80 to 90% of the patient, but for a sleeve gastrectomy it's just 40 to 50%. Still we don't have any option better than gastric bypass currently, but this kind of the surgery and treatment unfortunately can be done only in obese people, not for the normal people. So yeah, still I think people like to use pharmacotherapy rather than because you have to remove the stomach from the body. Yeah.
Okay.
Yeah.
Thank you.
Thank you.